My name is Paul Grant. I am a co-author of the book Recovery into Cognitive Behavioral Therapy for Serious Mental Health Conditions. I worked with Tim Beck, or Aaron Beck, as you know him, for a lot of years, 20. I really feel very honored that Dr. Alan Francis is here to maybe talk with me a little bit about this book, which is the last one that Beck published in his lifetime. And I think one he was quite proud of.
To start, Tim Beck was, and his daughter Judy, I think were two of the best therapists I've ever met. And the thing that they both bring to every encounter with patients or with anyone is this tremendous humanity. And I want to congratulate you and Tim for a book that I think brings alive what the experience of having schizophrenic symptoms is like, brings alive what's important for a therapist to understand, and makes the cognitive therapy a four-dimensional, a biopsychosocial treatment, not just as some people do it following the book. So I think it's really a brilliant book, and I think it will change the way people treat psychotic patients forever.
And we wanted it to be very practical so people could pick it up and just put it into practice. You might remember his first paper, and 52 was actually on psychiatry, was actually on somebody who thought they were being persecuted. And at the time he made that, the tools he had were Freud and Adolf Meyer. If you read it now, that's what you could see. And towards the end of his life, we were talking about that, how many more things he had to bring to bear when he returned to these disorders 20 years ago. And he had the cognitive model, which he did not have in 52. And he had his theory of modes, which we find to be extremely useful for figuring out what to do when you meet somebody and they just don't seem to have any access to motivation. They don't want your care. They just are so demoralized. They find their environment impoverished. What are they going to do? We've got things you can do to tap into. The theory of mode tells us the person is still in there. Their best self is still in there, and we can reach them. And I think the big discovery that we made is that we realized the cognitive model could be applied to, shall we say, someone's best self or some of their positive attributes. And that, you know how Beck was. That was a game changer for us. Once we realized that now we have a template for that too, that's really what opened things up for us. Because a lot of times the people aren't so motivated. Well, you'll have less of these sort of negative beliefs. Well, hey, no, now you can actually have these positive beliefs become more active, and you could be more the person that you always thought you could be. And that's really what this is about.
My first patient was a young woman with acute psychotic symptoms, and I couldn't relate to her or her symptoms, and I was lost. And first year resident. And my supervisor quoted Sullivan with a statement that stuck with me for the rest of my life and influenced everything I did with every patient ever since. And Sullivan said something like, people who are suffering from schizophrenia are much more simply human than otherwise. And I realized I was trying to treat symptoms, not the person.
Yeah.
And that once I realized that the symptoms were okay, we would deal with them, but it was the person I needed to know and to understand and to talk to and relate with. And what Tim had, and what you must have working with him all these years, is a tremendous ability to see beyond the symptoms and to realize that the person is so much more than their diagnosis, so much more than their symptoms, and that the secondary effects of having the problems often cause as much trouble as the problems: the demoralization, the giving up, the sense of isolation from everyone, the loss of dignity. And I think what your book does is bring back the dignity to the person and bring back the dignity to the treatment. And so many people with severe symptoms are neglected in this world. We have 600,000 people with severe mental illness who are in prison, on the street. And it's partly because we've forgotten these are people and we need to treat them as people.
Which that's exactly what this book is trying to do, is say that here's the person behind the symptoms, and this is how you can reach that person, and here's some things you can do. And the other thing we did is we recognized that a lot of the people who given these diagnoses were like what you've described, really those secondary problems that really marshaled on them, will not always see a therapist. So the stuff we had needed to be, to the other people who are involved in the care could also bring some of this stuff to bear. especially people who may not even have advanced degrees, like the direct care workers, the peer specialists, people like that. They can follow the template as well. They can have a way of seeing the person behind the symptoms and then move forward as well. And teams as well can do that. So that's the other thing.
Well, I know a number of people who work with the homeless, and I think this book is enormously helpful because it's not something that you exclusively can do in an office setting. You have to be able to treat people where they are and what they need at that moment. And the techniques are so simple, so obvious. I learned more about treating schizophrenia in my first year in residency in the emergency room than anywhere else because the security guards were so good at it. Security guards knew how to distract, how to give some orange juice, how to relate to the person, how to give them a sense that they were important. And I think that's what the book does. I think the book I think the book does for schizophrenia what Marshall Linehan's work did for borderline personality disorder. That in both instances, populations of people who were designated difficult patients and no one wanted to see them. That your book and Marsh's book made the difficult patient a really interesting person and someone who needed help and could be helped. Anyone can treat easy patients, partly because easy patients often don't need treatment. But to be able to do well with difficult patients, that's the art, that's really the calling of being a good therapist. And I think your book helps people face difficult situations and difficult patients with a sense of being armed with understanding the person and not just being frightened by the disorder. I think a really wonderful thing about the book is it presents a rounded, four-dimensional biopsychosocial spiritual view of model of the encounter. That you're not against medication. Many patients will need medication to be able to do the rest of the treatment and participate in the relationship. But you go way beyond medication, which is necessary for the symptoms, way beyond it to take into account and to respect the patient's psychological reactions, their social settings, and the needs, the terrible needs that individuals with severe illness have in meeting just where to live, how to get food. You're interested in their life, not just in the symptoms. And also there's a spiritual element, not to give up hope. How do we find meaning, even in the difficult moments of life? So it's an inspiring book. It's a book that I thought I knew a lot about this, but I found myself learning much more than I actually knew. And it inspired me to continue the fight to get better help for patients with severe mental illness. Thank you for writing it.